Hey all, my name is Jessica and I'm with KHR. We are a boutique company that helps small business owners solve HR issues. Usually when people think of us, they think we just do payroll or benefit administration, or they think we're just another PEO. But we are the real deal. We're a locally owned, women-owned small business right here in downtown Orlando. We have a fully staffed HR department with SHRM certified professionals available to help our clients stay on top of daily changes in our industry. That being said, I've had a lot of questions from local business owners in the Central Florida area, and due to the type of business we are, we receive all the latest updates and resources available for business owners with regard to COVID-19. And the truth is it would be a terrible waste for me to only share this information with my existing clients. So I've created these videos as my social distancing way to help educate the community and provide access to resources that are available, with the hope that I'm able to make a difference and help as many businesses out there as possible improve our local economy as a whole. Now, a quick copyright disclosure. Under Section 107 of the Copyright Act of 1976, allowance is made for fair use purposes, such as criticism, comment, new reporting, teaching, scholarship, and research. Fair use is permitted by the copyright statute that might otherwise be infringing. Non-profit, educational, or personal use tips the balance in favor of fair use. We can all win together. Now on to today's topic. The U.S. Department of Labor issues workplace guidance for coronavirus outbreak, including specific guidance on FMLA, FLSA, and FECA. On March 9th, the Department of Labor's Occupational Safety and Health Administration, known as OSHA, issued a new alert and guidance on preventing worker exposure and preparing workplaces for COVID-19. On the same day, the DOL's Wage and Hour Division issued guidance on common issues that employers may face in responding to the various coronavirus scenarios or other public health emergencies under both the Fair Labor Standards Act and the Family Medical Leave Act. While the Office of Workers' Compensation Programs published guidance that outlines the Federal Employees Compensation Act, coverage for the federal employees as it relates to coronavirus, on March 11th, the World Health Organization declared coronavirus a pandemic. To reduce the impact of the COVID-19 outbreak on conditions in businesses, workers, customers, and to the public, and to help employers identify risks specific to their workplaces and implement appropriate control measures. According to OSHA, this guidance creates no new legal obligations, but contains advisory recommendations as well as descriptions of mandatory safety and health standards. OSHA's guidance identifies the various steps that every employer can take to reduce the risk of worker exposure to coronavirus in the workplace, including the development of an infectious disease preparedness and response plan, which should take into account the level of risk associated with the various work sites and job tasks that workers perform at these sites. So that plan should include identification of sources of exposure to the workers and prepare to implement basic infection prevention measures. The CDC discourages workers from using other workers' phones, desks, offices, work tools whenever possible, and maintain their regular housekeeping practices, including routine cleaning and disinfecting surfaces, equipment, and other elements in the work environment. When choosing chemicals, employers should consult information with the Environmental Protection Agency for approved disinfectant labels with claims against emerging viral pathogens. You should develop policies and procedures for prompt identification and isolation of sick people. You'll need to develop and implement and communicate workplace flexibilities and protections, things like encouraging sick people to stay home and ensuring sick leave policies are flexible and consistent with public health guidance. You'll need to implement workplace controls, including things like high efficiency air filters, increasing ventilation rates in the workplace, and installing plastic barriers. Administrative controls like modifying workers' schedules to minimize their exposure to workplace hazards, using email and teleconferences or telecommuting, and changing workplace schedules so that the number of workers who are present at work site at one time is reduced. Practice safe workplace habits like providing hand soap, hand sanitizer, and tissues. Professional protective equipment. Employers are required to provide their employees with employees with PPE needed to keep them safe while performing the duties of their jobs. The types of PPE required during a coronavirus outbreak should be based on the risk of the infected while working and the job tasks that may lead to exposure. Examples of this include goggles, face shields, masks, and respiratory protection when appropriate. The General Duty Clause of OSHA, which requires employers to provide a place of employment free from recognized hazards that are causing or likely to cause death or serious injury and harm, and the OSHA's Airborne Pathogens Standard that applies to occupational exposure to human blood and other potentially infectious materials. Now, OSHA's guidance on preventing workplace exposure. Well, there's the lower risk people. Employees whose jobs do not require contact with people are suspected to be infected with coronavirus and in frequent contact with the general public. PPE is not recommended for this group. Employees, medium risk people, employees who have frequent contact and people who may be infected but coronavirus but are not known or suspected to be coronavirus patients, or employees who have contact with the general public, such as schools, high volume retail sales, high population density work environments. Things that you can do to help your employees: install physical barriers like sneeze guards where feasible. Consider offering face masks to ill employees that contain respiratory sections, such as post signs including information, automated messages when prescriptions are ready for pickup, or restrict access to certain areas of your workplace. Now, some employees may need to wear some combination of gloves, gown, face mask, face shield, or goggles. Now, with high risk, coronavirus people are such as healthcare, delivery support staff, medical transport workers. Really, we need to ensure that appropriate air handling systems are installed and maintained in healthcare facilities that are going to remain open. Other things you can do is provide all workers with initial refresher training class on COVID-19 transmission and prevention. Provide personnel alcohol-based hand sanitizer containing at least 60% alcohol. And these people will likely need to wear gloves, gown, shield, goggles, face mask, respirator, depending on what their job tasks and risk exposures are. Now, very high-risk people are employees with potential for known exposure to expected sources of coronavirus during specific medical, post-mortem, or laboratory procedures, such as healthcare, laboratory, or morgue workers. And the OSHA suggests that they follow the same guidance as the high-risk people do. Now, the DOL's guidance on Fair Labor Standards Act and the DOL's Wage and Hour Division have also issued guidance on common questions that employers face under FLSA and FMLA in connection with responding to coronavirus and other public health emergencies. For example, pay to non-exempt employees during coronavirus business closures. Under the FLSA, employers are obligated to pay non-exempt employees only for the hours worked, not hours the employee otherwise would have worked if the employer's business had not closed. If telecommuting or working home is provided as a reasonable accommodation, the employer must pay non-exempt workers the minimum wage at least time and 1/2 at the regular rate of pay for overtime hours. Pay to exempt salaried employees, including requiring such employees to use vacation time or leave without pay during business closures. Under the FLSA, employers are generally obligated to pay exempt salary employees their full salary in any week in which they have performed work, with limited exceptions. If an employee has not accrued enough time to cover the absence, the employer still must pay the employee's full guaranteed compensation amount in order for them to remain exempt. Employers are not required to pay exempt salaried employees in weeks for which they do not perform any work. Restrictions on employees able to work. Employers may also offer telecommuting and reasonable accommodation or infection prevention strategies. The FLSA does not limit the number of hours or days per week that an employee aged over 16 can be required to work. Job duties. Employees aged over 18 may be asked to perform work outside of their job description. The use of volunteers. The private sector employees who are short-staffed may seek to use volunteers to perform tasks. The DOL notes that the FLSA has stringent requirements with respect to the use of volunteers. In general, the FLSA covered non-exempt workers working in private for-profit employers have to be paid at least minimum wage and cannot volunteer their services. Employers that are private, not-for-profit organizations or public agencies that may fall under certain exemptions are encouraged to check the DOL rules for governing circumstance while volunteering in public and private nonprofit sectors may be allowed. Temporary employees. If an employer brings on temporary employees from a staffing agency to supplement its workforce during staffing shortages, the employer may be jointly severely liable for unpaid wages if the employer is deemed a joint employer. Offering alternative work arrangements to quarantined employees. Employers are encouraged to be accommodating and flexible with workers impacted by the government-imposed quarantines. The DOL specifically notes that telecommuting may be offered as a reasonable accommodation for employers and must provide such employees with the same hourly rate or salary, encouraging other employees to telework. In doing so, employers may not single out any employees, or that would be in violation of the equal employment opportunity laws. If teleworking is provided to an employee pursuant to a contractual agreement or part of reasonable accommodation, the employer must pay for the employee the hours actually worked at least minimum wage for the regular hours and at least time and a half for the regular hours paid worked in excess of 40 of a work week. Employers are still required to maintain accurate record of all hours worked for all employees and are encouraged to work with employees to establish hours of work and for employees who telework and a mechanism for recording each teleworking session of the employee's hours worked. Reimbursement of telework expenses. If an employee is required to work from home, an employer may not require an employee to pay for or reimburse the company for business expenses of the employer, where doing so reduces the employee's earnings below the required minimum wage and overtime compensation. Telework or home office requirements. If OSHA receives a complaint about a home office, it may informally let employers know about such a complaint, but it will not follow up with the employer or employee. Employers who are required to keep records of work-related injuries and illnesses will continue to be responsible for maintaining such records, even if the injuries or illnesses occur in a home office. The DOL guidance on the Family Medical Leave Act. Employees with infected coronavirus may be entitled to FMLA. Where complications arise that create serious health condition as defined by the FMLA, they may be eligible for up to 12 weeks of unpaid job-protected FMLA leave, and employees must meet certain requirements if they work for a covered employer, including employment offered by their employer for at least 12 months. Employees on FMLA leave are entitled to the continuation of group health insurance coverage under the same conditions as coverage would have been provided if the employee had been continuously employed during the leave period. The guidance further notes that workers who are ill with pandemic influenza or have a family member with influenza are urged to stay home to minimize the spread of the pandemic, and employers are encouraged to support these and their community mitigation strategies and should consider flexible leave policies for their employer. Leave taken by an employee for the purpose of avoiding exposure to the flu or pandemic would not be protected under the FMLA. Now, there are some sections in here that have been updated since March 12th when this article was written, so I'm just not going to read those sections here. Now, sending employees home. Employers may send employees home if they show symptoms of pandemic and influenza. Employers must obtain objective evidence that the employee poses a direct threat, risk of significant harm, to determine that there is no available reasonable accommodation that would pose undue hardship and eliminate the direct threat. Ability to seek medical information from employees returning to work. Employers may require an employee who is out sick with pandemic influenza to provide a doctor's note or submit to a medical exam or remain symptom-free for a specified amount of time before returning to work. However, the DOL asks that employers bear in mind that During a pandemic, the healthcare resources may be overwhelmed and it may be difficult for employees to get an appointment with doctors or other healthcare providers to verify they are well and no longer contagious. Under the Americans with Disabilities Act, an employer is permitted to require a doctor's note, a medical examination, or a time period during which an employee has been symptom-free before allowing them to return to work. Employees' ability to modify paid leave policy if it becomes unable to pay. The federal equal employment opportunity laws do not prohibit employers from changing their paid sick leave policy if it is done in a non-discriminatory manner. Employers whose employees are covered by FMLA must have a sick leave policy that complies with FMLA. Lay off some employers. If an employer temporarily closes because of pandemic and chooses to lay off some but not all employees, employers must bear in mind that federal laws prohibit discrimination still apply. Employers may not discriminate against an employee because he or she has requested to use FMLA or a similar leave under state or local laws. The Worker Adjustment and Retaining Notification Act, or WARN, helps to ensure advance notice in cases of qualified plant closings and mass layoffs. The DOL encourages employers to consider other options such as telecommuting in lieu of laying off employees who are taking care of sick family members. Employers keep in mind that under the ADA, qualified persons may be entitled to unscheduled or unpaid leave, and modifications in the employer's sick leave policies are reasonable accommodations. Well, there you have it. I know this is helping our clients already, and I hope it will help you too. If you have any thoughts or comments or questions, please put them in the comments section below. If you have found this video informative and helpful, please like it by tapping the thumbs up button. My contact information as well as the links for this video are located below. I will be adding content regularly going forward. If you want to learn more, please subscribe. Thank you for listening. Stay safe and healthy. Namaste and God bless.